Welcome. I'm glad you were able to make it back from the Children's Hospital for your 6-month adult neurology residency evaluation.
It's good to be back in the adult hospital. The child neurology year really stinks. I hate it over there. Crying babies, panicked parents, ridiculous. I know the child year has been a tradition for decades, but I think it's worthless for the most part. When am I ever going to do pediatrics after I finish neurology residency?
As an adult neurology residency program director, I understand your frustration. We have been discussing this at the Professors of Adult Neurology meeting for the last 10 years. Remember though, many adult neurology jobs require seeing children.
Really? But only one graduate from our program in the past 10 years sees kids now, and only on call. Could we convince the APPN to proportionally reduce our child neurology to something reasonable for patient care, like 3 months? Adult cardiologists don't do any cardiology training in kids.
Yes, but remember, neurology is special. You are training to be a neurologist. A neurologist understands all the intricacies of the developing central and peripheral nervous system from prenatal, through neonatal, infant, toddler, child, tween, preteen, and adolescent years. There is much more to learn about pathophysiological principles through the lifespan in child neurology than we will ever have to learn in adult neurology. The full child neurology year is vital for your career. You have plenty of time your other months to learn the special qualification in adult neurology stuff.
I'm skeptical. If I am never going to treat children again, do I really need a full year of child neurology? More importantly, doesn't the child year take away from more relevant clinical experiences? Reducing child neurology to 3 months would give me 9 extra months of useful education.
What about localization? Your child neurology year gives you the opportunity to localize lesions in the developing nervous system. Geriatric neurology is really just pediatric neurology in a perverse, distorted, reverse direction. The skills you gain in localization in children will form a foundation for your neurology skills throughout your career. If we reduce the child neurology training year to 3 months, you simply won't be prepared. A whole generation of weak neurologist clinicians will result. Ugh.
But adult neurology medical knowledge is expanding exponentially as we speak, and I feel like I'm missing it. Anyway, localization seems overrated. It's not like the old days of angiography and paper EEGs. We have MRIs now and digital EEGs.
True, but child neurologists order MRIs and EEGs with reckless abandon. You'll never have another opportunity to see so many normal scans and tracings, along with every conceivable genetic and acquired abnormality. Not just stroke.
Fine, but what about medical knowledge? Look at vascular neurology, to take one example. While I'm over at the Children's Hospital trying to understand thousands of genetic and metabolic diseases, I'm missing the opportunity to see lots of patients with strokes. I can barely remember Binswanger's disease.
Enough stroke already. You will have plenty of time after you complete residency to familiarize yourself with the minor adult neurology knowledge you missed while learning to be a good neurologist at the Children's Hospital.
I guess you're right. But adult medicine is pretty complicated too. And there is so much kid stuff I'll never need. Adults are not just big kids.
You just don't get it, do you? Asking a resident what they want to learn is a complete waste. You just don't have the perspective I have on what you need to know.
Are you sure you are not just keeping me in the Children's Hospital because I am cheap labor?
Of course not. Your education comes before money and hospital staffing. I tell you what, I'll ask the RRC if we can set up a task force to modify the child neurology year. We'll keep all of the mandatory 12 months of child training for adult neurology though. In the next 5 to 10 years we should have a great plan that I'm sure your ancestors will appreciate. I am certain we can find many child neurology months that will enhance your adult neurology training experience.
Hooray. Yeehaw. I feel much better now. You have convinced me that even though a full year of child neurology causes me to miss a vast quantity of career-relevant training, that I really am better off with a full year of child neurology. I guess the founding fathers were right to require a full year of child neurology training for certification in neurology with special qualification in adult neurology. After all, as you say, there's much more to learn in child neurology than should ever be learned in adult neurology.